The remote landscape of Argentine Patagonia, characterized by its sprawling vistas and the jagged peaks of the Andes, is currently the focal point of a significant international public health investigation. On May 2, 2026, the World Health Organization received formal notification of a cluster of severe acute respiratory illness cases involving passengers and crew members aboard the cruise ship MV Hondias. This vessel, which departed from the port of Ushuaia in April, has become the center of a multi-country response following the confirmation of Andes hantavirus among its travelers. As of mid-May, health authorities have documented 11 cases, including 3 fatalities, yielding a case-fatality ratio of approximately 27%. While hantaviruses are present globally, the Andes strain identified in this cluster is unique due to its documented ability to spread through person-to-person transmission. This specific characteristic has historically transformed vibrant mountain communities into what some observers describe as ghost towns, as local populations retreat into self-imposed or state-mandated isolation to halt the viral spread. To understand the gravity of the current situation, one must look to the precedents set in the Chubut province, where the virus is endemic. Hantavirus pulmonary syndrome, or HPS, is a severe respiratory disease caused by infection with hantaviruses, typically transmitted to humans through contact with the waste of infected rodents. However, the Andes variant, formerly known as orthohantavirus andescens, carries a different set of risks. In the 2026 outbreak, investigators are meticulously tracing the movements of an index case, a traveler who spent 4 months traversing the endemic regions of Nuacan and southern Chile before boarding the ship. This scenario mirrors past events in the town of Epuyén, where a single introduction of the virus into the human population triggered a chain of infections that paralyzed the region. For viewers following these developments, the concern is not merely the presence of a rodent-borne pathogen, but the potential for social and economic disruption that follows when a community must choose between total isolation and continued transmission. The current surveillance efforts are not just about tracking a virus. They are about managing the profound uncertainty that arises when a known pathogen exhibits aggressive, human-centered behavior in confined spaces like a cruise ship or a remote village. The core of the current public health challenge lies in the mechanics of transmission and the rigorous laboratory work being conducted by institutions like the Malbrán Institute in Buenos Aires. Historically, hantavirus is acquired through the inhalation of aerosolized particles from the urine, feces, or saliva of the long-tailed pygmy rice rat. Yet the Andes strain has fundamentally changed the epidemiological playbook. During the landmark 2018-2019 outbreak in Epuyén, researchers identified what are now termed superspreader events. In that instance, 34 cases and 11 deaths were linked back to 3 symptomatic individuals who attended crowded social gatherings, including a birthday party and a funeral. Genomic sequencing revealed that the virus could be transmitted during the early stages of symptoms, a period when an infected individual might still be socially active. This reality forced health officials to implement a strategy known as selective isolation. In the Epuyén case, nearly 100 people were placed under a 45-day mandatory quarantine, a move that predated the global protocols of the COVID-19 pandemic. By applying these measures, the reproductive number of the virus, the average number of people infected by a single case, was reduced from over 2 to less than 1. Currently, in 2026, this same strategy is being deployed on a global scale as passengers from the MV Hondias return to their home countries. Countries including France and Spain have reported confirmed cases among repatriated travelers, leading to intensive contact tracing and preventive isolation of those who may have shared enclosed spaces with symptomatic individuals. In the clinical setting, the virus is notoriously difficult to manage. Patients often present with a rapid onset of fever, muscle aches, and fatigue, which quickly progresses to respiratory failure. Data from the 2018 outbreak showed that nearly 82% of patients required respiratory support, with over 90% exhibiting bilateral interstitial lung involvement on radiological images. The medical community remains constrained by the lack of a specific vaccine or antiviral treatment, leaving supportive care as the only viable intervention. This lack of a silver bullet highlights the importance of laboratory-confirmed diagnostics, where technicians look for specific indicators such as thrombocytopenia, a low platelet count, and elevated lactate dehydrogenase levels to predict the severity of the disease in its earliest stages. The path forward in managing hantavirus risks involves a combination of environmental vigilance, public education, and a sober acknowledgement of the limits of current medical science. Prevention remains the primary defense for residents and travelers in Patagonia. Public health guidance emphasizes the importance of airing out enclosed spaces such as sheds or cabins for at least 30 minutes before entry and using a bleach solution to disinfect surfaces where rodents may have been present. In the context of the 2026 cruise ship outbreak, the World Health Organization and the CDC have underscored that while the risk of broad international spread remains low, the complexity of managing an Andes virus cluster cannot be understated. Surveillance teams continue to monitor rodent populations as environmental and ecological factors significantly influence the prevalence of the virus. There is also a focus on the social impact of the disease. Survivors often report a lingering stigma, recalling periods when their towns were shunned by neighbors and their families were viewed with suspicion. This social fracturing is a byproduct of the intense fear generated by a virus with such a high mortality rate. Officials stress that while the current outbreak is a serious public health event, it is a contained chain of transmission that usually reaches a natural dead end once isolation measures are strictly enforced. Experts, such as those from the Universidad de Córdoba, point out that the critical window for intervention is during the first few days of symptoms, which are often indistinguishable from common influenza. Therefore, the current directive for any traveler returning from endemic regions who develops a fever is immediate referral to a high-level intensive care unit. As of now, the international response remains focused on reconstructing the exact route of the index case and ensuring that all contacts are monitored until the 42-day incubation period has passed. The goal is to prevent the recurrence of the ghost town phenomenon by replacing fear with precise, data-driven isolation protocols. As we continue to track these developments, the resilience of affected communities remains a testament to the importance of transparent reporting and proactive surveillance. Subscribe for more updates on global public health developments. The core of the epidemiological response to the hantavirus threat in Patagonia is centered on the rigorous diagnostic and sequencing work performed by the Malbrán Institute in Buenos Aires, which serves as the primary reference laboratory for the region. Historically, hantaviruses are categorized as zoonotic diseases, transmitted to humans through the inhalation of aerosolized droppings, urine, or saliva from infected rodents, specifically the long-tailed pygmy rice rat, or Oligorismes longicaudatus. However, the Andes strain, which is endemic to the mountainous regions of Argentina and Chile, presents a distinct and lethal characteristic that separates it from other variants like the sin nombre virus found in North America, the documented capacity for person-to-person transmission. This unique transmission mechanism was scrutinized during the 2018-2019 outbreak in the town of Epuyén, where health officials tracked a single index case to a social gathering. Investigators determined that a 61-year-old man who had been clearing a shed and likely contracted the virus from rodent waste attended a birthday party while symptomatic. This single event resulted in multiple secondary infections, which then triggered a cascade of tertiary cases, including infections among healthcare workers and attendees at a subsequent funeral. The clinical progression of the disease is described by provincial health authorities as both rapid and devastating. It typically begins with a prodromal phase lasting 3 to 5 days, characterized by high fever, intense muscle aches, and gastrointestinal distress. Medical records from regional clinics show that as the viral load increases, patients often experience a sudden cardiopulmonary phase, where the lungs fill with fluid, leading to acute respiratory failure and shock. In the Ipsen cluster, the case fatality rate reached approximately 32%, a figure that forced the Ministry of Health to implement drastic selective isolation protocols. Under these emergency measures, over 100 asymptomatic individuals who had been in close proximity to confirmed cases were placed under a mandatory 40-day quarantine. This was not a voluntary guideline. It was a legal requirement enforced by local police and the judicial system to prevent the virus from exiting the rural mountain valley. Laboratory testing remains a bottleneck in rapid response, as initial symptoms mirror common influenza or even COVID-19, often leading to delays in isolation. To combat this, surveillance teams have increased the use of enzyme-linked immunosorbent assays, or ELISA, to detect specific IgM antibodies, along with polymerase chain reaction tests to identify viral RNA in blood samples. The burden on local infrastructure during these periods of high transmission is immense. Rural hospitals, which are typically equipped for basic care, must suddenly transform into high-security isolation wards with advanced mechanical ventilation capabilities. Furthermore, the specialized nature of the Andes virus means that every confirmed case requires an exhaustive contact tracing effort that spans weeks, mapping out every social interaction the patient had during the incubation period. The uncertainty surrounding exactly when an individual becomes contagious, whether it is only during the symptomatic phase or shortly before, continues to be a primary focus of ongoing research at both the Malbron Institute and international partner agencies. This scientific ambiguity necessitates the conservative 40-day isolation window, a time frame designed to cover the maximum possible incubation period and ensure that no silent carriers inadvertently spark a new chain of transmission in neighboring population centers. The management of hantavirus, particularly the Andes strain, necessitates a multi-layered strategy that combines environmental surveillance, strict personal hygiene protocols, and international coordination. At the foundational level, public health agencies in South America utilize ecological monitoring to predict ratadas, or rodent population explosions. These events are often triggered by the mass seeding of the Colehiu bamboo, an event that occurs once every few decades and provides a sudden, abundant food source for the long-tailed pygmy rice rat. By tracking these environmental cycles, authorities can issue early warnings to rural communities and tourists months before an outbreak might occur. For the individual, prevention is centered on mitigating the risk of aerosolization. Official guidance from the World Health Organization and local ministries of health emphasizes that any structure that has been closed for an extended period, such as a summer cabin, a tool shed, or a barn, must be treated as potentially contaminated. The protocol requires opening all doors and windows for a minimum of 30 minutes to ensure thorough ventilation before entering. Crucially, residents are instructed never to use a broom or a vacuum cleaner, as these methods can loft dried rodent waste into the air, creating the very microparticles that transmit the virus into the deep tissues of the human lungs. Instead, a disinfection solution consisting of 1 part household bleach to 9 parts water should be used to thoroughly soak any suspected nesting sites or droppings before they are wiped up with disposable materials. For those working in high-risk agricultural or clearing occupations, the use of N95 or FFP2 respirators is considered a mandatory safety standard to filter out potentially lethal viral particles on a global scale. The 2026 MV Hondius incident has highlighted the critical role of the international health regulations in managing pathogens with person-to-person transmission potential. Surveillance now extends far beyond the borders of Argentina and Chile, involving a synchronized effort to monitor travelers during the 42-day incubation window that is characteristic of the Andes virus. This surveillance is not merely a data-gathering exercise. It involves the active monitoring of body temperature and the immediate isolation of anyone presenting with even mild febrile symptoms. However, the limits of current medical knowledge remain a significant hurdle. There is currently no widely available vaccine for hantavirus, and while research into DNA-based vaccines and the use of neutralizing monoclonal antibodies shows promise in laboratory settings, supportive care in an intensive care unit remains the only proven clinical intervention. This gap in the medical arsenal places an even greater emphasis on the ethics of public health measures. The implementation of mandatory selective isolation, while effective at stopping the spread, carries a heavy social and psychological burden. Authorities must balance the necessity of quarantine with the rights of the individual, ensuring that those in isolation have access to food, medical monitoring, and mental health support. The phenomenon of the ghost town serves as a stark reminder of the social fragmentation that occurs when a community is defined by its disease. In towns like Epuyen, the path to recovery involves more than just clearing the virus. It requires rebuilding the trust between neighbors and overcoming the stigma associated with being an epicenter of infection. Public health officials stress that the virus is not a permanent fixture of the landscape, but a manageable environmental risk that can be neutralized through education and vigilance. As we move further into 2026, the lessons learned from the Patagonia clusters are being applied to global biosecurity frameworks, emphasizing that early detection and transparent communication are the most effective tools in preventing a local outbreak from becoming a broader crisis. The honesty of this approach requires acknowledging that while we cannot eliminate the rodent reservoir, we can significantly reduce human exposure through disciplined adherence to established safety protocols. The current situation remains under close watch by international experts who remain focused on the